안녕하세요. Hello, my name is Dr. Byun. I specialize in breast and body contouring. Nice to see you guys. I'll be always glad to answer any questions you have about plastic surgeries of the body contouring. So let's begin some Q&A. Okay, so for the first part of the question, it totally depends on how much fat you have accumulated over the past years and how much we're gonna take out. Most young people still has pretty good skin elasticity. It doesn't really require any of the manipulation of the skin, and the skin usually doesn't get saggy after liposuction. So adequate safe amount of liposuction will take out a plenty amount of fat that is under the skin and dermis, and even after that the skin has its own recovery time and elasticity, and it will kind of contract back to its original form. Usually don't have to worry about the sagginess of the skin. But in cases of some pretty more overweight people, and where cases of multiple liposuction has gone through lead to some sagginess of the skin, we could always manipulate the skin through other surgeries. And for the abdomen, for example, is the most commonly known as tummy tuck or abdominoplasty. So we usually go through a small incision near the inguinal area that could be hidden under the underwear, or near the C-section scar if you have one. And if we cut the lower part of the skin that's sagging, we could recover fit looking, very tight skin of the abdomen. And it could also be applied to your arms or the thighs or through other lifting of the skin. Okay, so during the liposuction, first we insert some specialized formulated saline inside. It's called a tumescent fluid. So that's kind of a mixture of saline and other some medicines together. And what that does is make the fat cells swollen. It makes the whole liposuction much more easier and prevents pain. It also prevents irregularities after the surgery. And because we insert such fluid inside before the process of liposuction, there will still gonna be some swelling and liquid left inside your fat layer after the liposuctions. So what we have to do is wear a compression garment to make the swelling go faster, and it also has to do with the skin elasticity. So many people are worried about skin sagginess after liposuction, so wearing a compression garment at least a month after the surgery helps the skin recover its own elasticity and have its correct fit form after the surgery. That's why we usually recommend wearing it. So the calf part is a little bit different from other parts of common liposuction, such as the arm, abdomen, or the thigh, because lower leg or actually the forearm is similar too. So most of those distal part of our body is kind of mostly formed with bone, muscle, and skin itself. For the lower leg or the calf, we still have two very big bones of the lower leg, and right over that there is two thick muscles called soleus and gastrocnemius, and that's kind of the main volume of the calf area. So even if we do liposuction of the fat that's over the muscles that's there, that's maybe not enough volume to give a very dramatic difference compared to the muscle or the bone volume. So usually for the calf area, that's the case. We usually give Botox injection to the muscles. So it's kind of a different approach than liposuction. We try to decrease the size of the muscle of the lower leg, and that could dramatically reduce the circumference of the lower leg, and you may not even need liposuction in that cases. Liposuction is basically for anyone, because it's kind of physically removing the fat that's already there. So regardless of how much you have fat before the surgery, even if you're a relatively thin person or a relatively overweight person, whichever that comes to us, we could physically remove what's there, and everybody's gonna have a dramatic effect. So it's a very safe surgery. We only go through the very superficial layer that's under the skin and above the muscle, so that's not changing anything in the deep layer or doing any harm to the anatomy itself. So it's a safe surgery, it's a quick recovery surgery, and basically there's not even sutures to take out. We only use observable sutures and skin bonds, so the recovery is fast. As I said before, the only thing you have to consider is wearing a compression garment. Without that, anything like daily activities and even exercise is very quick recovery. So about 3 to 4 days after the surgery, you could go on, do any like weight training or cardio exercise, that's totally fine. If any particular part of your body has been a physical complex of yours or have given you a lot of stress for the past years, feel free to contact us. We could always give you what's appropriate for you and tell you if it's gonna be a good effect for you or not. Yeah, thank you very much, and I hope to see you soon.